How can you tell OA damage from aging on an MRI scan? Imagine looking inside a joint and seeing clear signs of where that tell a story of damage beyond what age alone would cause. That's where MRI scans for detail come into play. They help doctors differentiate between normal aging changes and actual osteoarthritis damage. On an MRI, healthy cartilage in older adults usually looks pretty uniform. It stays thick and smooth with no major defects. But in osteoarthritis, the cartilage shows significant thinning and irregularity. You might see areas where the cartilage surface is worn away or disrupted. These appear as darker or altered signals on the MRI, indicating cartilage breakdown. Quantitative MRI techniques like T2 mapping can measure water content and collagen health. Higher T2 values suggest more water and collagen damage, which is typical in osteoarthritis but not in normal aging. Bone changes are another clue. Mild bone marrow signal changes can happen with age, but osteoarthritis causes more noticeable bone reactions. These include bone marrow edema, which looks like fluid buildup inside the bone, subchondral cysts that are fluid-filled cavities under the cartilage, and increased bone density called subchondral sclerosis. These features show the bone's response to joint stress and cartilage loss. Osteophytes, or bone spurs, are common in aging but tend to be larger and more prominent in osteoarthritis. MRI can clearly show these bony outgrowths at joint edges, which are a hallmark of joint remodeling in osteoarthritis. Meniscal degeneration and tears are also more common in osteoarthritis, especially in the knee. MRI can reveal meniscal extrusion or damage that is not typical in normal aging joints. Inflammation is another differentiator. Osteoarthritis can cause synovitis, which is inflammation of the joint lining. MRI with contrast can highlight thickened and inflamed synovial tissue, something rarely seen in normal aging joints. Doctors use scoring systems like the MRI osteoarthritis knee score to evaluate these features systematically. Comparing MRI findings with the patient's age, symptoms, and medical history helps confirm whether joint damage is due to osteoarthritis or just aging. Early osteoarthritis shows cartilage defects and bone marrow edema, which are not signs of normal aging. In short, while aging can cause mild joint tissue changes, osteoarthritis damage on MRI is marked by focal cartilage loss, bone marrow swelling, osteophytes, meniscal damage, and soft tissue inflammation. MRI's detailed images make it easier to tell these apart and guide proper treatment.